Hello, and welcome to Assemblies of the World with me, Anna Isabel. And I'd like to welcome CABI member Ruth Milner today. Hello, Ruth.
Hi, Anna. Lovely to
Uh,
see you.
and you, we've met a few times in different meetings. You're a member of our Healing Hub, and and I've been learning a little bit more about what you do each time that we get the chance to speak. You are in Northamptonshire Assembly, and so tell us about your work that led me to invite you into the Healing Hub. So clearly, it involves healing. So tell us about your background first of all.
Yeah. Well, my background really started about 30 years ago, really, in this journey into the world of using electrotherapy. And in the last, uh, well, since 2006, I've not only been involved in the world of using electrotherapies, but also I was introduced to the wonderful world of using red and near infrared light. Back in 2006, there was already a good 10 years or so of using modern light, medical grade diodes for um, wound healing, especially. Um, but yeah, it was, pardon the pun, a light bulb moment for me. Electrotherapies are wonderful, but they do require consumables, and mostly not always that suitable for home use with bigger pieces of equipment. Um, but the development of modern photobiomodulation, which is the specific type of light therapy that I specialize in now, makes it very, very safe and affordable for home use. So, it's bringing one of the most researched types of light therapy to into the homes of everybody to use. And I think what excited you was that I mentioned our journey with this particular type of light therapy was predominantly being used on animals, because that was the only machine that we were actually allowed to sell in the UK. Um, so the particular device that I've been involved in um, comes from South Africa. And yeah, according to regulations, yeah, for the devices for people have to go through stringent regulatory um, uh, tests, and it took a long while for the units for humans to actually be available for us in the UK. But since 2013, we started with just a device license for animals, and that's been an incredible journey because it allowed myself and the team here to actually appreciate how the light is so beneficial for animals.
Great. That's wonderful. And you've given us a heap of information. So I think we need to tease that out because a lot of this is very new to us. So when you were talking about electrotherapies, I think a lot of people are going to think about sort of electric shock treatment, that kind of thing, which is not really what you're talking about.
No.
So would you like to tell us what electrotherapies are and how that differs from light therapy, which is what you're now working with?
Yeah, well, electrotherapy is very, or has been very popular. It tends to go um, in and out of fashion. I would say over the 30 years, what I've realised is that, yes, sometimes it's very popular, and sometimes, especially in the UK, unfortunately, our Health professionals are not given a lot of training about it, but predominantly electrotherapy has been used in rehabilitation treatments and programs by physiotherapists, for example. So when somebody gets an injury, muscle tear or ligament and tendon issue, electrotherapy is introduced into the body in different waveforms, different types of current. The professional machines definitely are quite sophisticated and need to be applied by a trained practitioner, trained professional. But in simplified form, a lot of your listeners will probably be familiar with the idea of using TENS machines. My first experience of TENS was using it when I was in labour, when I had my children in the 90s. So when I got the opportunity to join a business that was already involved in the consumables for electrotherapies, and across the world we've supplied a lot of the manufacturers, and it's progressed very well. But I think beyond the application of electrotherapies, because you do have to know what you're doing really with electrical, using electrical current applied with electrodes, different sorts of electrodes. Lots of manufacturers use their own customized electrodes, and they need to be conductive, and it's specific electrodes for specific circumstances. So yeah, it obviously TENS and some muscle stims and that sort of thing are suitable for home use, but in its kind of full range of electrotherapies, it really does need to be delivered by a trained professional. Whereas I think what excited me about the progress of using light instead of electrostimulation, and it's just a different form of energy. That's all it is. It's using wavelengths of light rather than electrical current, because we are electrical beings. And yeah, the light makes using a device offering energy into the body a much, I think a lot of people are more confident with that, because a lot of people mention to me, oh, is it like the old infrared heat lamps and that sort of thing? And yeah, a lot of people, I think, are generally more comfortable with the idea of using light.
So just to go back a little bit, because this is very new territory for most people. So the TENS machines, can you, so that we have a really good grasp of what we're talking about here, can you describe the procedure for how they would be used, so that we have a contrast, a clear contrast with the different light therapies available? So let's go back to the TENS machine. How would that be used?
Well, electrostimulation needs to be delivered into the body via electrodes. And the positioning of electrodes can be quite specific. So, for instance, if you were using a TENS machine to help block pain signals in the process of late, in when a woman's in labour, yeah, you'd sometimes it's 2 electrodes across the spine, the lower back. Sometimes it's 4. But essentially the electrical stimulation from the little device that you use, and usually a woman, the lady in labour will have a boost button as well, where she can boost it when she has a contraction, and it increases the intensity of the current going into the lower spine, and it just helps to block the signal from the contractions to the brain and that sort of thing, and also to stimulate the body's own endorphins. But I think what happens a lot of the time with electrostimulation is that the body quickly gets used to the level, and it's constantly having to be adjusted and increased. The body gets used to the intensity, and yeah, it sometimes it doesn't, have its full effect the more you use it. And I know there's definitely machines that are available for elderly people that to put their feet on, and that all helps with in the peripheral and lower leg circulation, which we know might get impaired as they get older. But yeah, generally, it can be a bit tricky, I think, with getting the right setting
So we're
for, and
essentially,
some people don't like the sensation, in all honesty, with, because
yeah,
it's
it's
pins and
an electric
needles.
current. Yeah, it's an electrical current. So we're using electricity, and you gave an example of one of its uses being to block pain, which is what I was familiar with. So it's almost like an anesthetic type uh,
Yeah,
um, use for this. Okay, so that's fine. We have these TENS machines and others that are doing that job, and we can see the attraction, and we can also see its limits, and we can also see why many of us might think, I don't know about this. So now we have a different another option, which would be light therapy. So, and you've been talking about, different machines, and how you've been using them, and the rigorous testing that all these machines have to go through in order to be approved for use by the public. Can you explain to us more about the light spectrum, and which parts of the spectrum you are actually using, and why those particular wavelengths are beneficial?
yeah. So in my journey with the studying the effects, the beneficial health effects of light therapy, I was introduced to the organisation, the International Light Association, and I've had the privilege of attending conferences and work and online workshops, and I've just learned, really about the visible and slightly invisible light spectrum. So what we know about this narrow kind of band, or octave probably, of from the visible light spectrum, and you've got at either end you've got the UV, ultraviolet, UVA, UVB, UVC. UVB is the type of UV light that we understand is the type of, it is the wavelengths that predominantly where we synthesize vitamin D. So it's, although the blue end is high intensity, or high frequency, and we have to limit our exposure, it does have health benefits, as long as it's, you're not overexposed, as opposed to when, as you're moving through the visible light spectrum from your blues and your greens, going to your warmer wavelengths, and as you move through that spectrum of visible light, the wavelengths get longer and low frequency, and certainly the red and the infrared spectrum of wavelengths have been extensively studied. It's certainly true that all the colours have beneficial health effects physically, emotionally, psychologically, and even spiritually. but we are quite fortunate in the fact that certainly what's been found with the low frequency, long wavelength spectrum of the reds and going into the near infrared, so that's the cold part of the infrared light, has been recognised to have a profound regenerative effect on us and animals at a cellular level. There was a Russian scientist called Tina Karu who went on a 20-year research program and studied all the colours and how deep do they go into the tissues and that sort of thing. And what she found was that towards the early 90s, mid 90s, she'd had realised that it was the red and the near infrared wavelengths that go that bit deeper into the body than other colours. And she finally discovered the phenomenon in 1995, which has not been disputed across the scientific spectrum, that the key mechanism with using those specific wavelengths was the firing up of cellular energy at a mitochondrial level. So the action happens in the mitochondria to produce this increase in cellular energy. It's like putting a set of jump leads on the body, really. Obviously we know how important a good diet is, eating a rainbow and try and eat as clean as you can. But what has been realised over the decades of even prior to the Second World War, there were pioneering researchers looking at light and colour, is that we are receptive to light. Animals are receptive to light, and we have this various receptors in our bodies that respond to light. When light is applied on our bodies in specific doses and a reasonable level of intensity, that what we're doing is we are kind of firing up our electrical potential. So apart from the main mechanism that has been identified so far by the Russian scientist Tina, there's been other mechanisms that have come into the fore that have been recognised. That's what it's doing. All it's doing is firing up the body's ability to heal. And as much as the food is highly, highly important, in some respects, we need that spark.
We do. And, nothing really thrives, or very few things thrive without light. So light is clearly very important. And there's so much within sunlight. As you say, there's an entire spectrum of frequency that we would perceive as color, not least of which, I think you said that the purples are what we need in order to be making our own vitamin D.
Yeah, I think it can go further than just the vitamin D, but for sure, I think there's more risks with the exposure time with blue light. There's obviously concerns, isn't there, with using our devices with the blue light. You're supposed to turn off or put the filter on to block the blue light, certainly for the later you are in the evening, because the blue light exposure does is one of the things is block our melatonin production, which affects our sleep-wake cycle, our circadian rhythm, whereas the red light actually enhances our production of melatonin.
So, okay, I'm thinking holistically here. And we know that in allopathic medicine, drugs are used, and that for many drugs, their origins begin in the plant world, but that instead of giving people the whole plant or the leaves of the plant, they extract a chemical, which then may be effective in some ways, but as we know, is overall problematic because the the initial um, the initial herbal medicine had a lot more than that compound, than that chemical, and it rounded it off, made it more nature friendly, and therefore our bodies deal with them better. So I'm just wondering here, because we talk about blue light, and we know that blue light is extremely problematic. As you say, it can stop the production of melatonin and affect our circadian rhythms, etc. And that blue light has been taken away, shall we say, it's been isolated from the whole spectrum of light that we get in the sun. So is there a danger when we are doing exactly the same thing with red light? We are isolating it from the whole spectrum.
Mm-hmm.
Is there a danger that there may be some sort of side effects from just using it on its own?
No. What has been found, well, obviously there can be risks depending on the type of light devices you're using. So in the professional world, this particular modality predominantly focusing on the use of or the application of the visible red and near infrared were delivered via laser, therapeutic laser diodes, or devices. So when you're using any true laser device, even when it's like some of those ridiculous cat toys, with a laser pointer, laser can be harmful to the eyes. And without a doubt, the accepted mainstream scientific research, the vast majority of the papers up till maybe the 90s was always with using laser devices, and they are still around. You've got professional lasers now, which I would say are not suitable for home use, but trained health professionals that are trained on the risks of the lasers. So you have to be careful with reflective surfaces and that sort of thing. They get brilliant results, but light is light. And what excited me with the growing or the burgeoning field of red and near infrared light was that with light emitting diode devices, i.e. the light spreads out like a torch. It's incoherent. Our sunshine is incoherent light. It's not pinpoint beam. The worst that can happen, to be honest, Anna, is that nothing happens with those light sources. We in the work that we're doing with a particular type of device brand that has got the medical licensing, and when I mentioned about medical licensing, all that does is enables anybody selling those devices to make an actual legally make a clinical claim that it can be effective for a particular health problem. There are plenty of devices coming onto the market that haven't gone through the regulatory procedures, and it is currently a bit of a wild west out there. But yeah, I mean, you can't really do any harm unless any device that you buy is electrically unsafe and has battery problems. But the light itself from a light emitting diode it does not pose the same risk, and it won't, it won't start any adverse chemical reaction in the body, or have what's called the ionizing effect, which is what you get with the blue light spectrum, because it's high frequency wavelengths.
Okay.
But interestingly, I need to mention this. So the International Light Association, when I went to the conference back in 2018 in Norway, the very first speaker there was an award-winning researcher from Scandinavia, and the talk is actually on the YouTube channel for the ILA, and his talk was titled "Sunbeds, Healthy or Dangerous?" So obviously overuse of sunbeds is a no-no, like getting yourself burnt in the sunshine. But interestingly, over 30 years of his research, he'd concluded that, especially for the people that are live in the northern latitudes of the world and well away from the equator, our inability to get proper vitamin D from the sunshine, it stops in October, and we can't start using it again in April. Scandinavians get even less. So he concluded from all his research of 30 years of data looking at the prevalence of chronic health issues because of lack of vitamin D, was that if we could have controlled exposure and maybe use sunbeds in the winter 5-10 minutes to be able to get that vitamin D production maintained throughout the winter months, the benefits would outweigh the risks. And
That's very interesting.
Yeah, it's very, very interesting.
Because really what this conversation is reminding us all of is the importance of sunlight. And yet, certainly as long as I can remember, we've been told that the sun is harmful to us. We mustn't lie in the sun. We must use sunblock, and etc., etc. Personally, I don't use anything at all, because I don't like the chemicals that would be going into my skin. So I don't use that, and I find just gradual exposure to be a very effective way of avoiding sunburn. So what you're now saying is really just illustrating how badly we actually do need the sun. And and in the same way that we would need to use sunbeds sensibly, we also, because we get so little exposure to the sun, it just comes out, doesn't it?
It does. It does. And after that talk, I was thinking, because obviously my knowledge of how profound the regenerative wavelengths are with red and near infrared light, now that got me thinking that there's obviously limitations, and you have to limit your exposure when you're using sunbeds. But if the lighting designers or developers could get together and actually produce a sunbed system that incorporates all the wavelengths. I mean, obviously in the commercial world, manufacturers are limited to the sort of lighting systems that are commercially available, and with the best will in the world, bulbs and light sources aren't representative of the complete sunlight spectrum, are they?
Exactly. That's precisely what I was saying.
Yeah.
My analogy with plant medicine versus chemical medicine. It's there's something missing when we start playing about, because it's not what nature intended, and what nature intends is for us to have that whole spectrum, and yet you are using the color, or you're using the red frequency very successfully. So coming back then to the importance of this red frequency, what is it that you are using it for? Where is it helpful?
Pretty much everything, to be honest. There's been some very interesting work with regards to certainly near infrared. So what has been discovered now with the importance of sunshine and the near infrared. So what is being talked about now is that the scientists are saying that it's the near infrared wavelengths. So say slightly going into the invisible infrared. It's cold infrared. It's not the thermal infrared, although that's still beneficial, but it's cold infrared. It's those particular type, a range of wavelengths that actually reflect off of the green in nature, and it intensifies, which is why when we go out, well, possibly one of the reasons why when we go out in nature, forest bathing, we feel quite revitalized. And but as opposed to using sunbeds as in just UV, now there are whole body systems using red and near infrared that are certainly being used for performance enhancing for athletes, as well as recognizing that it's highly beneficial for people with chronic conditions, painful conditions. So one of the fastest effects, biological effects to kick in, is the pain relief. And we see that all the time with the animals. Actually, that's one of the fastest effects that really you can start to feel and experience from having red near infrared light applied onto, even if it's just a small area like a joint where you've got inflammation. And pretty much any trauma or any injury, whether it's from age, disease, surgery, whatever, there's that initial acute inflammation, and that's where it's been scientifically shown that the application of that range of wavelengths in reasonable doses applied properly really assists the body to start naturally getting on top of that inflammation and helping the body through each stage of the healing process. So it fires up all that signaling from the initial trauma, or even prior to elective surgery. There's good evidence now showing that, if you've got to have surgery, then, to fire up and prep the cells before the surgical trauma happens, then that gives the body a bit of a head start. But yeah, the thing is now, Anna, it's what's possible, that with photobiomodulation now. I attended the PBM 2024 summit in London last August, and the field of application is expanding all the time. We've got really good dose guidelines for, say, musculoskeletal issues, wounds, and pain, where you can apply the light on the surface of the body to help with joint pain, joint degeneration, arthritic pain, fibromyalgia maybe. As I say, there's whole body systems now that people can, if they're really, they're systemically inflamed, they can go and have treatments on full body systems, which they have to pay for. But you can have a really good little home use device to be your first aid doctor and apply as soon as you've like cut your finger, or your animal has done an injury, or you know. And the thing is, it's proving that it's beneficial across many species. I mean, we've first had initially our first amphibian case as reptiles, you know, not just our domestic cats and dogs and little furries, but it's been used on elephants, to pangolins, and you know, all sorts. So yeah, predominantly the science is carried out either on a cell cultures or even cadavers, and that has its limitations because it doesn't show the interaction of the light in living tissue. But on real life humans, it's you know, it's to be applied regularly. Think of light as a nutrient. You know, just giving yourself a session once a month isn't going to cut the mustard. It's like, you know, regular consumption of good quality nutrients that your body needs. And you know, when I teach, I always say to people, well, unfortunately, we're mal-illuminated these days because we live in artificial light. We don't go out, and we get the wrong light at the wrong times. We also get bad quality light, which affects us as well. And all this has a detrimental effect on our energy system. So just a little bit of those regenerative wavelengths will start the ball rolling to help fire up that cellular energy. And you know, obviously, if you're already quite reasonably healthy and well, you know, it can be used just proactively for wellness and to help be part of your regime, and also for your animals, especially if they're competing. Animal athletes, you know, in agility and working animals and that sort of thing, you know, they are athletes at the end of the day. Muscles work really hard. So your muscles are jam-packed full of mitochondria, and that's where, you know, applying light as part of a wellness regime can be beneficial, as well as obviously when there are diagnosed issues and you really need to be aware of what your device can offer in terms of the dose, and tailor it to you, because we're not all the same. You know, we do respond a little bit differently to these energy modalities. But you know, I think, to be honest, you know, as long as people do their research and they buy a device that is has shown to be as, no, on a par with some of the professional machines, then, and they use it sensibly and regularly and don't stick it in a drawer and forget about it, then you know, it's going to become part of your wellness regime.
So what should people be looking for if they're wanting to invest in a home device?
Well, there's obviously little handheld devices with concentrated small air, you know, a small area like that, where you can get into small parts of the body, especially for animals. You can get, if they have feet problems, or you can get all round an elbow. But the thing is, in the animal world now, there's a lot of manufacturers, maybe overseas, getting on the bandwagon and mass producing wearable systems. In the animal world, I'm very conscious, or all the practitioners we work with are very conscious about consent-based treatment. The same goes for when you're practicing Reiki on animals. Very often, I think probably your listeners that are aware about how they approach animals, it's got to be on their terms. And the same goes for applying any light therapy devices on animals. You've got to do it with their consent. And we have information that we give out to just make animal carers and pet owners aware that you don't go in like a bull in a china shop with animals, even though they've come away from the vets. And you know, the animals get white coat syndrome as well. You know, they
Oh yes, I've got one of those.
yeah.
And no, Teddy will not have any of it. So I have to always work with his consent. And if he doesn't give it, believe me, you know all about it.
Yeah, yeah. And quite often, I think some owners, well, not often, but it sometimes we'll get somebody saying, "Oh, my dog doesn't like this. They won't. They're scared of it." Well, yeah. If you're coming towards your dog for the very first time with some bright torch, then they are probably going to be put off. Some obviously love it, and it's really interesting, Anna. They will tell you. You just have to learn to listen, and although they can't speak, they tell you. And if you're tuned into your animal and you're observant and you're patient, quite often they will say, "No, I don't want you to do it there. I want you to do it here," and they'll reposition themselves to where they want it, or they will come and ask for it, or if they see you using it, then they will come and say to you, "I want some as well, please."
I have interviewed many practitioners who work with massage therapy and different types of therapy with animals on my channel Pet Talk with Anna and Teddy. And this theme is a recurring theme where they learn or they know how to acquire the consent of animals, and they all say that the animals will tell them where it hurts,
Yeah,
where
yeah,
they need it, and where they're not supposed to, have any, where they feel most tender as well, so that you have to be most careful. So
yeah.
yes, this is right. So okay, so let's come back to, I want to buy a device. I want it for my home. Specifically, is there a tick list that you can give me to look for as I'm flooded with images as I look online
Mm.
for different devices? What would you say?
Well, it really depends, I think, on the what your listeners might be looking for, and whether their animal is relatively healthy, and whether they're just looking for something just to help with maybe warming up before sports, or even a walk, or whether they have got a golden oldie, who's quite arthritic, and they're quite stiff in the morning, or whether they're already undergoing maybe a physiotherapy treatment. But ultimately, the wearable red light therapy products that are for animals and people, to a large extent, they don't have the regulatory certification, so they can, we know over generally the modality is beneficial, but yeah, the wearable products are much weaker, so they have to stay on the body for longer. If you're, I mean, fine if you want to use a pad. I mean, there's usually pads with lots of different diodes in pads, or even specially shaped ones for necks, for example, necks and shoulders, or there's some systems where you can actually secure them with like Velcro straps around the abdomen, that sort of thing. Then if it's for a person, then that's with consent. But just be aware that even if you go out and buy a pad or something, you've got to know that your animal is going to be comfortable with having something directly attached to their body. The other thing is that if you go for a handheld device, usually they are more powerful, so they don't take as long to apply, but it's still worth your listeners doing a little bit of research on the actual level of dose that they're going to be able to get from their device in a certain level of time, because if they are tackling a chronic painful condition like osteoarthritis or slip discs, often we get inquiries from people that are in acute pain with sciatica and things like that. Now, if you want to get on top of really severe acute pain or chronic pain, the dose applications that you would need to use are a lot stronger than if you're just, and it also depends on your pain threshold. So yeah, I think my advice would be is for somebody to do their due diligence on what the device actually offers in terms of the power output and the dose level that you're going to get in a reasonable amount of time. How convenient is it going to be for your lifestyle, for example? It can, there's devices obviously that can fit in really well with a physiotherapy regime, but obviously if you're yourself or your animal is in recovery and you have to do exercise as well to strengthen. And that's one thing that I have to say is using this type of light modality, it won't strengthen your muscles. You still have to do the physical therapy for that and the controlled exercises if there's muscle wastage, you still have to get that back. But what the light therapy will help with is mobilizing your movement. You get better range of movement. You don't get such intense delayed onset muscle soreness after physiotherapy and after exercise, that sort of thing. But for wound healing, and whether it's from surgery or you've had an accident and cut yourself, just a very quick dose is very beneficial because it's superficial. It's not right deep inside a joint, whatever. What is interesting coming down the line is that the academics and researchers are developing these systems into fiber optics now to be used deeper inside the body. But if you've got somebody that's familiar with acupressure points, then you can apply just quite a weak output power device onto an acupoint, and that will go deeper into the meridian system.
Wow. Well, that's brilliant. Thank you. Thank you so much for, illuminating our understanding of light therapy and the different ways in which it can be used to help bring healing to us and to the animals in our lives. Ruth, if people wanted to find out more about what you do you have a website? Is there a way that people can get in touch with you?
Yes, yeah. So the device that I'm involved in is called Photizo, Photizo. They have been developed and manufactured, and all the regulations that take place in South Africa. But our comprehensive website here, which has a huge amount of blogs about all the animals and people, is on Daintree Health Products, and Daintree is DANETRE healthproducts.com.
Wonderful. Thank you very much for your time today. And a reminder to everyone that The Healing Hub is very active in working together, all of us, to help our communities and bring wonderful experts of different disciplines to help everyone around us. So if you are a health practitioner or a mental health practitioner of any kind, and you are a member of CABI, do get in touch. And if you're not yet a member of CABI, today is the day. There will be a link in the description box for you to be able to join. Until next time, goodbye.